Hello and welcome to everyone tuning in. We are so excited to have you here with us on Nest Builders. A special welcome to all our families tuning in from around the country who attend one of our Nest schools. We are so thankful for you and for being a part of the Nest family. Tonight, we are excited to have with us three guests, all from McKibben and Monte, who specialize in pediatric therapy throughout Ohio. They are joining us to discuss how to nurture development in our children. And let's take a few moments to let you all introduce yourselves and tell us a bit more about McKibben and Monte. Let's start with Lauren Baird.
Cleveland-based occupational therapist with McKibben and Monte. Just a little bit about McKibben and Monte. We're very unique because we do offer comprehensive early intervention services. And what makes us a little bit different is that we offer our therapies in the child's daycare and preschool. So there's a couple reasons why that's really unique and convenient. First of all, for parents, it's really nice that they don't have to take their child to a therapy session after a long day of working. And another aspect is that it's really convenient because the therapists are then able to work with the child's teachers, and which is a very important skill for carrying over skills that's taught in therapy. And then also, what's neat about us is that we actually have no wait list. So as soon as there's a need, we send out a therapist and they're able to evaluate and start treating your child. So that's a little bit about McKibben Monte. Some areas that I specialize in as an occupational therapist, I do sensory processing, and one of my passions is self-regulation. So hopefully we'll get to talk a little bit about that tonight. I also love play-based therapy, child-led therapy, and I've also been working with children with autism for over 10 years, which is a passion of mine.
Hi there, my name is Jennifer Hyman. I am a pediatric speech language pathologist. I've been in the field for just over 15 years, and I specialize in prompt. It uses touch cues to help children with motor speech deficits and disorders, and I also use play-based therapy.
Hi, everyone. My name is Emma Westling. I'm also a pediatric occupational therapist. I've been in the profession for about 5 years now. I'm really committing my profession and my passions to pediatric feeding, specifically picky eating, which I'm hoping we'll touch on today, but then also play-based therapy and neurodivergence in supporting the autistic population.
Wonderful. Well, it's really great to get to know you all a little bit. We're excited to have you here and talk about this topic and help our audience learn a little bit about how they can successfully nurture development in their children. So let's jump right in. We want to kick things off with a discussion on ear infections and how they impact speech and language development. It's a very common thing for young kids to struggle with, and they often have a lot of unseen impact. So how can multiple ear infections impact speech and language development?
You know, this is a really great question, and it comes up so frequently with parents, especially in the daycare setting, because we have such a nice relationship with parents as well as teachers, and a lot of communication when kiddos are out sick. Multiple ear infections can really impact speech and language development in several ways. First and foremost, significant chronic recurring ear infections, if we're not treating them right away, can often lead to temporary or even permanent hearing loss. These losses can really lead to some difficulty with articulation, which is when we're talking about those kind of speech sounds that make it difficult to understand kiddos when they're talking, and that delayed language development. Difficulty hearing and understanding that spoken language in the classroom, that can come out as having trouble listening or following directions, developing those age-appropriate vocabularies, some of those social communication or play skills that might look different than their peers, and also just producing language that may not be the same as their peers in their classroom. So really that early treatment and getting in there and that early intervention is really critical for kiddos that do have those chronic ear infections. So that was a really great question.
Anyone else want to weigh in there?
I think Jen hit it.
Great. How does a parent know if their child's speech is delayed?
So again, a really great question. Based on our most current research, We expect that by the age of 6, most children should be able to be using all of those speech sounds accurately. So if you're listening to this and thinking, my kid's not producing all those sounds, they're sounding different than other kids their age, and I'm having trouble understanding them, or their grandparents or my parents are having trouble understanding them, that might really be a red flag or a sign that there might be a delay. If your child seems frustrated when they're trying to speak with you or avoiding speaking, in certain situations, it might be a really great time to consult a speech language pathologist, or if their teacher is mentioning these things to you at pickup time or drop off time, it might be time to consult a speech language pathologist.
If a child's hearing has been impacted by ear infections resulting in speech and language delays, what can parents do at home to help?
Yeah, so creating that language-rich environment, that supportive environment at home is really key to working with your speech language pathologist to incorporate those goals that we're developing into their daily routine. So things like reading books together, that's a great way to improve language and vocabulary. You can point to pictures, ask questions, really allowing those opportunities for that natural communication to occur. Expanding on those utterances and things your child says. So if they're pointing to something and saying car, you can say, I see the red car, really expanding on that language that they're using. Even thinking about going on an errand like the grocery store, just tons of opportunities to add language into everyday activities. Nursery rhymes like Twinkle, Twinkle, Little Star, and predictable games, like I Spy, are also great ways to incorporate predictable fun routines into their day, just like in their classroom.
Wonderful. We love to do the story time, and this is all wonderful information. Because I have a 9-month-old, I'm very I want to be sure that we can make sure that we know the signs early. So far, so good, but so we actually would love to start off our next topic, and we need the audience's help. Comment below, do you read to your child daily? And if so, when? While we get the answers from the audience, we will be talking about reinforcing positive behavior. So let's talk a bit more about speech. We know that hearing the stories we read to our kids ultimately is one way that we can help their speech development, but how about preventing it? A common concern is that both parents have been through speech therapy and they want preventative measures to help ensure their child does not experience them too. So what do you recommend to parents?
I always wish I said I had a crystal ball or we could prevent all speech and language delays, but that isn't always possible. In these scenarios, early intervention is critical in identifying, those potential delays, communicating any of those concerns you're having to your pediatrician, even your classroom teachers. Those are kind of your first line of defense, and or scheduling a screening with a speech language pathologist is a great place to start. Monitoring, like you were just saying with your son, those milestones at an early age, and surrounding your child with a language-rich environment at home and school. So like we just talked about, reading those books and singing those songs, playing games, really that interactive play and narrating your daily routines, that's just the most excellent start to build those blocks for promoting speech and language development.
Wonderful. Does anyone else want to weigh in on that?
Yeah, I can say when my oldest was going into kindergarten, she was in the COVID period when it was all happening and she was just going into kindergarten. And I was super worried about the way that she was pronouncing words, and I didn't know if it was typical. So I just kind of reached out to her school and said, hey, can you do a quick screen? And they did. And they said, things are looking typical. And again, like Jen said, I think it's really important to if you have a concern, you kind of have this instinct as a parent to know that maybe something might be off or that you want to look further into it. So I don't think you should ignore that instinct and just make sure that you do it earlier than later. I think, like Jen said, is really important.
That's exactly what I was going to say too, Lauren.
Yes.
Just your instinct. Absolutely.
Yeah.
What about stuttering? This is something that is sometimes seen in young kids as well. How can a parent know if their child's stuttering is something to be concerned about?
Much like those speech and language milestones, stuttering, there is some developmental stuttering that we do see with children between the ages, right around 2, 3 years old. We do see kiddos that have kind of those language explosions, and they will, parents will come and say, I just noticed my child started stuttering. So that's another time I'd say, let's consult a speech language pathologist. They will come in and take a developmental history and see if, is there a family history of fluency disorders. Sometimes we'll say, let's take the wait and see approach. Will they grow out of it? Or is this something that we need to intervene on? Take some strategies in the classroom or with the family.
Chronic thumb sucking can also cause a lot of concerns for parents. Can this impact speech development?
Unfortunately, thumb sucking and pacifier usage, that's a tough one. It can indeed impact speech articulation development, those speech sounds. That chronic thumb sucking and pacifier usage over time, it can change that shape of the palate and how those teeth are aligned. So it really changes those structures and can cause difficulty with the proper positioning of how we use those articulators, we call them. So those lips, the tongue, for how we make those speech sounds. So overall, it's going to change that speech intelligibility or how well we can be understood, and that clarity can be more difficulty. Thumb sucking can also make an impact and cause some abnormal swallowing patterns called tongue thrusting as well. So that is something we see when we're out in the field. We ask, is there any thumb sucking or pacifier usage? And we really try to negate that pretty early on.
I know that some of you have mentioned that you have kids. What time do you guys, well, I'm assuming you guys read to your children, but what time do you read to your children?
I'll go first because I just put mine down before this podcast started. So our son loves books. From the moment that he wakes up, he'll grab a book and he wants to be read right away. But my husband and I, we try at least by bedtime. Life is busy and the day can just fly right by without us even realizing it. So we always try at least one or two books in the end of the evening. And recently, his play shelf just right behind me, we've actually started setting out a couple books in his play area, and we've just seen an increase in his interest in those books when they're in his play area as well.
My kiddos are a little bit older, so I'm lucky that they get to read to me now, which is absolutely wonderful. So I really enjoy that time where I can kind of sit back and just listen to them read to me now.
Yeah.
Some of our audiences. Oh, go ahead.
I was just going to say our bedtime as well. And now I think, it encourages them reading to themselves too at night, which I've got 2 readers that are a little bit older. And I can definitely see reading the books every night has taught them that skill of kind of reading them to themselves before they go to bed.
Yeah, it's that nice wind down activity before bed.
Mm-hmm.
Some of our audience answers also have said bedtime, morning, at breakfast, after dinner. Is there a best time to read to children?
Oh, I can take this. I think anytime you want to read to your children is wonderful.
Yeah,
anytime
I would think so too.
Time in a day.
Who's going to stop a child?
Yes.
All right. Well, we are going to jump into another topic. Let's talk a little bit about behavior at school. The transition to school can be difficult for a lot of kids, sometimes causing some issues at school due to behavior. A question we get a lot from parents is, my child does not know his own strength and is often hitting other children at school, maybe even biting. What can be done? What is wrong with them? Personally, I think nothing is wrong with them, but how would you approach that?
So I do think that we can say that I have 3 of my own children, and I know that all 3 of them have had a moment where there was some hitting and there was some biting. So I think that can be a normal thing in children as they're learning to communicate and express their feelings. So I wouldn't say that it's abnormal. So I think when we're looking at that behavior, we definitely want to look at the frequency of it and how it's impacting their day if they're at school. If it's really impacting their ability to play and interact with other kids, and impacting social participation and education, then I think it's something that we definitely need to dive a little bit more into. So hitting and biting can happen for many different reasons, but a lot of times when I'm called in, if there's a concern, a sensory concern, are they doing it because it's sensory based? Is it behavior? That's a question that I get a lot. I always go in and we have to ask a couple of questions when we're looking at the behavior. So number one, is it sensory based? So what I look for a lot in that is if I hear a teacher or parent say, they're hitting and they're biting out of nowhere. I have no idea why they're doing it. It's just really out of nowhere. I can't figure out anything that's causing it. That's a good indication that it could be sensory based. So again, if you think of an infant who is often mouthing things, has a pacifier, it's a type of self-regulation. As adults, we do, we drink our coffees all day, we chew on some gum, all of those type of activities are regulating for our sensory system. So looking into that piece and see, are they seeking out some kind of input to their mouth, and they've learned to get it through biting, whether that be different objects or, we don't want it to be a peer, but that would be the first thing that we would look at. And then, asking some other questions about behavior. So the other two is, the other question I would ask is, are they doing it to escape something? So are they trying to escape an activity? It could be an environment or a person. Number three is it because they're trying to get attention? So again, you think about attention, it can be negative and positive attention from either a teacher, an adult, or their peers. And then number three, are they doing it to get something tangible? So is it there a toy that they want and they just can't communicate that they don't want to share the toy, or they want a specific toy? So when we're looking at the behavior, we have to kind of see why it's happening. And then once we figure out why it's happening, we can kind of put some supports in. Whether I found a lot of times when there is some sensory seeking through hitting or biting, the behavior often has multiple purposes. So again, they do have some sensory needs, but then they are doing it to maybe get out of an environment that's overwhelming, or when they're overstimulated, or when they get upset with a peer, or if it's, if they're upset about something. So I think we have to kind of look at all the pieces of it, because it can kind of tell us a lot about what's going on. And then, putting those supports in, whether it be sensory based or some behavioral supports at school that can help reinforce positive behaviors.
And I think just to piggyback off of Lauren, I think one of the reasons why we see biting so quick is we actually have, from a sensory perspective, like Lauren was saying, the receptor, the avenue that our body takes to calm itself or to regulate itself, it actually has the most receptors in our jaw. So that's going to be the biggest bang for their buck. That's why, like Lauren said, we see a lot of adults chewing gum, chewing on their pens, chewing their nails. Any kind of that oral input is going to be a quick way to slow and calm our body down. So for kids, when we don't have those other opportunities to chew gum or have a crunchy snack, a quick bite can do the trick for them.
Absolutely.
Transitioning is hard at any age, including for adults at certain times. Just assuring parents that our staff really focus on connections and building that relationship for any child who's having a difficult time. This is coming from the audience, by the way. One of my favorite things is having parents send in a family photo to the school email so we can print it out for them, laminate it, and they can have something tangible to focus on during those hard times. It gives them some things that their hands can hold, which usually decreases their hands-on with everything. Reassuring parents that we are trying a lot of strategies to further child to have a great transition. We'll work with them. I think that's one of our teachers.
That's great.
Go ahead.
Yeah. I was just going to say, I had a really hard time. My son, who's going to be going into kindergarten, he had a really hard time with transitioning and would often hit me because he was having a hard time transitioning into the school. So I think it's really important as a parent, when you're dealing with some of those behaviors, to recognize that, they're feeling. So just even sometimes when it can seem kind of silly, the way that they're reacting, just making sure that you're saying, I see that you're really, really upset right now. And just acknowledging that and staying calm and just saying, I see that you're really upset, but, we're not allowed to hit, we're not allowed to bite. And I think it's really important when you're teaching like self-regulation to we forget it as the kids get older. We just expect them to know how to do these things. As when you're thinking about an infant, you're automatically going to them when they're crying. Are you hungry? Or you need something to eat? So I think as the kid gets older, we forget that we need to teach co-regulation, which is, we need to help them work through those feelings. And a lot of times what an infant does is they express themselves through their physical bodies, and we need to teach them, I see that you're upset, your body is out of control, and just working on saying, getting them to say, I feel mad, I'm angry, and working from there and just saying, okay, well, I'm going to help you. And we can't expect them. A thing that I work on a lot is being able to recognize when to take a break. Kids will just keep working through it even when they're frustrated, and you have to really do that co-regulation and model it. I know a lot of times as a mom, I kind of just come out and say, because I'm doing it all the time at my job, I am super frustrated right now and I feel like yelling. So I'm gonna go exercise, I'm gonna go walk on the treadmill so I can feel a little bit better and I can help you. So just modeling it as an adult so they can see, oh, whoa, mom gets mad, mom gets frustrated, and not making those bigger feelings necessarily negative, and just kind of teaching them how to express it in a healthy way.
Love that. A question that we did get, going back to the biting, was is there anything that we can give them when, if they need it when they're biting?
Yes, absolutely. There's a lot of different things that we can do for oromotor input. So there's a lot of like the chew jewelry that you probably see online. That's a big necklace that has like a chew on the end of it. Providing crunchy snacks throughout the day. Even vibration to the jaw is a great one. So if there's like a vibrating tool that they can put on their face, that's a great one. And also crunchy snacks, drinking, through a straw, even putting like a thicker liquid, whether it's just like a smoothie or one of those yogurt drinks through a straw, and sucking is a very calming activity. And just making sure that we're providing it throughout the day, because once they're biting and they're becoming upset, we've kind of waited too long to give them that input. So you want to be proactive with it and kind of schedule it throughout the day and make a little routine of it and be consistent with it to help, provide that input that they're needing. So I don't know, Emma, if you have any other ideas and suggestions.
No, I love that. I think the two that I was really thinking about just with my feeding background was the crunchy snacks, and then like the smoothie or the yogurt drinks through a straw. Even some of those fruit leathers that are a little bit more resistive to, just to get a child to gnaw and really work those jaw muscles, can be that nice calming input for them as well. And like Lauren said, throughout the day, if we think about sensory as a cup, right? If we're having all these inputs being filled up in our cup, and if we're waiting until this cup is overflowing, it's really hard to keep the water contained. So if we're waiting for the child to start biting, it's really hard to backtrack. So if we are giving them these tools and these breaks throughout the day, that can help decrease that water level in their cup. Figuratively.
Oh, I love that metaphor. That was beautiful. That was a really good metaphor. I like that.
I'm very visual, so sometimes it's nice to have a cup of water.
Yeah. Nicely said.
Another question that we have gotten is not related to that, but what if a child refuses to wear socks or any other article of clothing to school?
Yes. Again, so that is, I to this day do not like wearing socks. I, as a kid, had a lot of trouble with clothing, and now that I'm an occupational therapist and I deal with it, I had, my mom and my dad had no idea that I was having hypersensitivities, like tactile sensitivities. So I think it's important to remember that, children have developing sensory systems, and what may not seem very noxious to us might feel like a pair of socks might feel like sandpaper on their feet. And they can't really communicate that to us, but they're communicating to us by, throwing a fit and having a tantrum when they're getting ready. So some things you can do for that is, when someone is hypersensitive to something, they want to know what to expect, because they're kind of going to go into an environment and they know they're going to get overstimulated, or they're going to wear the socks all day and it's going to bother them all day, and eventually, right, we're going to explode. Like Emma said, the water is going to overflow. So I think it's important to, in the morning, setting up some routine and a schedule. I've done this with my kids too, having a little visual schedule, because my daughter also had issues with clothing and socks and tags, is putting together a schedule so they have control and they know what to expect during their day. And then there's lots of different sensory friendly clothing options available. And then making sure when you're getting dressed, laying out some options and not giving them too many options. So having a routine, something that's consistent, that they know what to expect. Also important for ways that we can address tactile sensitivity with clothing too, outside of dressing, is we're going to want to provide a lot of deep pressure throughout the day and a lot of different tactile experiences. So we're kind of desensitizing their system, so they're getting exposed to different tactile experiences. So you can incorporate that. There's lots of fun sensory bins that you can do with beads and shaving cream and lots of different things to expose them to different textures. And, if their feet are sensitive, even doing some, textured mats underneath their feet and doing different feelings on their feet. And then another great way to kind of prep their body too is to giving them some deep pressure, even like putting lotion on their body before they get dressed. So you're kind of just helping regulate their sensory system before they're getting ready and dressed for the day. I don't know if Emma, if you want any other thoughts?
Wonderful.
I would agree with everything you just had to say. Yeah, I love those. There's a lot of really nice sensory bins just online, but Pinterest has some really nice strategies too. Even rice and beans, it does not have to be fancy, just something that the child can see what it's going to be like. And then even talking through the different properties of that bin can help regulate or maintain their sensory system too. So, hey, this feels a little bumpy, or this feels a little bit dry. Talking through some of that just to build that language. So then when they are wearing socks that feel itchy or painful or however way, they're able to gather that language that you had primed them with to give you a better understanding of what those socks actually feel like.
We had someone in the audience say that their daughter will absolutely not wear clothing with buttons. Is this a sensory thing? And is there any suggestions to combat that?
I think, yes, I think it could very much be a sensitivity. Again, I mean, sometimes we all get kind of rigid in some of the things that we want to wear. And I know you frequently wear the same shoes every day. I mean, we all have our little routine of things that we want to wear, but I do think buttons could be a sensitivity if you're thinking about if the buttons are directly on their clothing or touching their skin. That can just kind of similar to like a seam in clothing, that could be irritating and feel very uncomfortable to them if they have a tactile sensitivity. So kind of, so I don't know if buttons on jeans, or it probably depend if the button is touching their skin. If it is just like a shirt, you could probably put something underneath it. A lot of times there's really cool like compression shirts that you can wear underneath clothing. I know I work with a little girl and she kind of wears like a little unitard under her clothing for that specific reason. And it kind of just gives her like a little hug all day and helps with some of those tactile sensitivities. So she kind of wears like a little Under Armour under her clothing to help with that. So hopefully I answered that question. I definitely think it could be a sensitivity.
Yeah.
For sure.
Thank you. Me personally, to this day, and it was as a child, turtlenecks just make me feel uncomfortable, like I'm suffocating.
Yes.
Will not attempt that. And I did not know that was a sensory thing until, very recently. So good to know.
Absolutely.
Well,
yeah.
We are going to move on to our next topic. We want to talk a little bit about food. That's everybody's favorite topic. There are a lot of picky eaters out there. We need the audience to help kick this topic off. Tell us in the comments below how many different types of food does your child eat, and tell us how old they are and what they eat as like what do they like. We will share the poll results. But while the audience gets their answers regarding food, let's talk a little bit more about eating. Parents often tell us that their child throws tantrums when presented with new foods. Obviously, this is super frustrating to deal with. What can parents do to prevent this?
This is very frustrating. My son is right at this age, he's 14 months. So right at this age where picky eating starts to emerge. And as a mom, it is very frustrating. And this is something that I have a lot of training in. So I'm right there with you. I do want to put a disclaimer out there that picky eating is actually a typical phase. Between the 12 to 18 month is when we start to really see it. Just because these kids at this age are going through really big developmental changes. You know, their gross motor skills are changing. They're recognizing, hey, I'm my own person. I have a lot of autonomy. I'm trying to figure out where I can have this independence in this world. So eating is one of those things that they feel like they can target first. With that being said, picky eating to the point where we're not able to go out for dinner, we're not able to go to a birthday party, or you feel like we're short order cooking is a deviation from that typical. Some of the things I do want to preface to it, we can't guarantee preventing picky eating. You know, there are sensory components to food, but there's some different things that we can handle. Two tools for your toolbox that I want to leave every family with tonight. The first one is something called the division of responsibility. And the second is an 80-20 rule. So these two go hand in hand. The division of responsibility is this idea that was coined from a registered dietitian and family therapist. This has come up with the idea that parents are responsible for what, when, and where their children eat. And then the child is responsible for whether they eat or how much they eat, which as a parent, it feels like it's our job to make sure our child eats those 10 bites of broccoli or enough to fill their stomach, but we have to trust the process that our child understands when their stomach is full. What we start to see in this division of responsibility is if we as the parents start to shift our focus to how much our child eats through bribes, coercions, take 5 more bites and then we can be done. Our kids need some kind of responsibility just with their developmental growth changes here. So they're going to shift their responsibility to what, when, and where. So when we think about picky eating, that's our kids saying, well, I want chicken nuggets tonight, and I'm only going to eat chicken nuggets. So that can really start to fuel this picky eating cycle. So just remember, we are responsible as a parent, what, when, and where our child eats. Now, just because we say, I'm going to put spinach on your plate does not mean that we can expect our child to eat it. That's where this 80-20 rule comes into play. 80% of your child's plate should be preferred foods or things that you know, hey, my kid's seen this before. I know that they'll eat it. They'll fill their tummies up on this. But then 20% of their plate should be foods that they either have seen before or have not been interested in, or it's a brand new food, or it's a new presentation of a familiar food. I get that, you know, everybody's evening time or meal times can get pretty busy. So even if it's something like a sandwich that's a preferred food, just cut it into a different shape so it just looks a little bit different. But we can't expect our kids to eat new foods if we don't expose them to. So it's nice to have that 20%. So again, 80% of those foods being preferred and then 20% being new or non-preferred.
I love that. Gone are the days of the happy plate.
Yeah. But it's hard. I mean, I like I said, I even do that too. And I caught myself tonight with my son feeling rushed to get on the podcast, feeling rushed to get him to feel, you know, full with his belly. It's like, just please eat another meatball. And that's hard. So I'm right there with you. And if you feel like, you know, these tantrums are getting to the point where it's ruining a mealtime or your family can't sit down all together and we're having to short order cook or make things separate, that's when I would recommend reaching out for a consultation with an occupational therapist for a feeding evaluation, because it doesn't have to be that hard. We can make mealtimes successful again.
Wonderful. Well, thank you for sharing those 2 tools with us. I am going to say some responses from our audience. One person said my son is 10 and he still only eats about 3 foods. My daughter is 15 years old and she eats a lot of anything. She's always willing to try something, definitely makes more healthy choices than I do. I love that. Not a picky eater, went through a stage during 7 to 10 years old where it was definitely a tough time, but knowing that she has choices has really increased her variety of foods. When my child got older, I would have them help cook the dinner. We would be eating that night, and that helped a lot. I love that. Any tips that you guys want to share, or any topics you want to touch upon from those comments?
So I love meal preparation. That is going to be one of my biggest recommendations to expose kids to new foods because when we eat or when kids are presented with a new food, there's often that pressure, even if we're not providing what we think is that pressure on them. There's always that inadvertent pressure of my mom or my dad wants me to eat this. So when we're meal prepping, that pressure is taken away and kids can just freely explore. My son, we've got one of those learning towers. Again, he's only 14 months, so he's much younger, but he's got one of those learning towers, so he's able to be at the counter, and he has explored so many other foods than he has at the table in that tower, just because that pressure, that unforeseen pressure is taken off. So that's a really great one. As far as a certain number of foods that we would expect by age, it's pretty difficult to put a pin on it. But what we want to see is enough variety where you don't have to feel like you're serving the same thing every day. And why we want to avoid that is just because when kids have the same thing, or anybody has the same thing every day, you start to get sick of it. And then once you start to get sick of it, you can drop that food or you can take a break from that food. And if we're starting with, say, only 5 foods, and we eat one of those foods, every day for a week, and we drop that one food at the end of the week, well, then we're left with 4. And if we drop another food, then we're really decreasing our diet variety. So that's when I would reach out.
Anyone else want to weigh in?
I think family style has been really great at our dinner table. So again, they help make it. My oldest daughter, who's 9, is like cooking and baking, and so she helps with preparing the foods. And they always want to get involved, and then we kind of set it all on the table and pass it around. And sometimes they pass it around and they say no, thank you, and we pass it to the next person. But again, they're kind of seeing it and they're getting exposed to it. So I love doing the family style rule. And Emma, maybe you can weigh in on this too. So I do when I'm cooking something new, I put it on their plate, and we kind of have like this try it rule, and they're allowed to spit it out, and I just say, wow, thank you so much for trying it, and then we kind of move on. And sometimes they give it a thumbs up, and most times they say yeah, and then we move on. But I don't know if you have any comments on that one.
I love teaching kids to spit food out, and most parents are asking, like, wait, what? But I love that because a lot of times kids will feel adventurous and they'll feel ready to try a food, and then all of a sudden they get it in their mouth, and food is sensory, so it starts to change, and they don't know what to do with it, and they're not ready to eat it. So spitting it can actually increase their comfortability with that food later on. And to the point, this is something that most kids don't like to hear, but a lot of research tells us that kids need exposure to one certain food 10 to 15 different times to even know if they like it or not. So for them to try a bite, like you were saying, Lauren, and oh no, yuck, great, you tried it. We'll try it again. That's something that your body's still learning about. I wouldn't take that off the diet variety.
I love that. I'm sure the kids love that too.
Yeah.
Yeah,
They like the spitting, not so much 15.
We're kind of working on, politely putting it in the napkin, and then instead of going, so.
2 more comments. I have an 11-month-old, almost 1, who I can't get to eat any finger foods. He's only eating purees. He does okay with fruits, but otherwise I can only get him to eat one kind. I have to mix in a little veggie with it, but not so much that it turns orange. He doesn't like orange foods. The doctor has referred us to feeding therapy to assist with this. He also choked when we tried a finger food, so we stopped. So I think there's that fear there. And you know what? I am right there with them. My little one only eats purees. We're trying very little bits of a little bit more solid, but what are your suggestions for that?
I think the feeding therapy consult is going to be a wonderful avenue for this family. When I hear, the puree and we don't want to eat finger foods, my brain immediately went to sensory. We have the most touch receptors actually in our fingers and then in our mouth. So going back to that hypersensitivity that Lauren was talking about, if our children are hypersensitive or processing sensory information a little bit differently, we can be more apprehensive to grab foods with our fingers. I would be curious it's probably the case that this child prefers to be spoon fed versus feeding themselves. And right now, I would encourage this family to keep meal times positive until we can get the feeding therapy evaluation. But this is a really tough age. I know that one of the resources I leaned pretty heavily into was solid starts. Even though I do this professionally, I was still very worried about choking and gagging, which gagging is good. We want to see a gag. That's a reflex. That's actually our body pushing a food out to keep us safe. But that resource solid starts actually breaks down all of the different foods that you could ever imagine and how to prepare them from a size and preparation standpoint by each month. So if a family is starting to progress towards solids in this age range, they can go based on where their child is at and try different things. And it's all based on a visual too, and it's free.
I actually love solid starts. That is a resource we use mostly for actually the allergy aspect. They always have whether it's a common allergy or not, and how we should introduce it if it is an allergy, because that's something I'm super nervous about. And then we did have one more comment. I always offer a fresh fruit or veggie at every meal. So I think both boys are very good in that area. But meat, oh boy, it's so hard to get them to eat good protein besides peanut butter and less pork chops. They both can get down on those. They are almost 7 and 2. My oldest is resistant to trying new foods, where my youngest is super cool with eating a 4-day-old Cheez-It from his car seat. He'll eat anything. Anything you want to touch on there?
I love to hear fruits and vegetables are being offered. Protein is always one of those tricky foods, especially if we think about like a chicken breast or a steak, or especially the pork chop. It takes a lot of muscle and endurance in our jaw to break down that food. And meat changes quite a bit when we're chewing it. It starts out a bigger piece, and then as we chew it, it shreds, and then it gets softer, almost like a puree before we're ready to swallow. And I do encourage families to remember that in our country, we actually consider dairy as part of the protein, except a glass of milk, but like a cheese stick, cottage cheese, yogurts, any of those are all considered a protein that we would be surprised at how much protein our kids are actually eating. And I actually worked with a registered dietitian who said Reese's peanut butter cups, they have protein in them. So
That's all I
that's
need to
the
hear.
protein for the meal, that, there's the ideal, and then there's what's happening right now. So
Love that. Well, amazingly enough, we have reached the end of our show tonight. But before we call it a night, we want to get some questions from our families out there. So type your questions in the comments below, and we will try to get them. So let's just start off with a simple one. Do you feel that play is important to learning for a child?
I can speak on that one. It is everything to a child. It is so important. It's the basis of everything that they will learn going into school. So that's why I'm a huge believer in play-based therapy and letting a child lead a therapy session. When I go into my sessions, I just get to know the kid. We play and we make it fun, and I find things that they enjoy, and I use that to my advantage to teach skills that I want them to learn. So I think it is, it's one of their core occupations as a child is play, because that is how they're going to learn, for sure. So important.
Absolutely. And to piggyback off your response, I think we all mentioned it on our intros. We are play-based therapists to the max. Really, that overall development. They're learning social skills. They're working on their emotional regulation, how to share, how to be a friend, all those language skills they're learning, all those different levels of play that they're really working through. It's just so critical that they're working on those play skills. So if you ever think you're not doing enough, just get your kiddo down on the ground and play.
Absolutely. Okay, we have questions. 3.5-year-old boy, he will eat bread, rolls, and chicken nuggets, will not eat fruit and veggies. Should we be concerned?
So I guess another follow-up question would just be, are those our only 3 foods? And then are we not eating any fruits and veggies exclusively, or are there like fruit snacks, that possibly we would have? But going back, I think at the beginning we talked about trusting your parent instinct. If you have any sort of concern, the worst thing that can come from an evaluation is saying everything looks good, right? So it's better to get checked and have an evaluation from a feeding therapist just to cross those boxes. And especially as a parent, if you're feeling like I don't know what to serve my child, meal times are stressful, that's absolutely something that would warrant an evaluation as well. Because eating happens 5, 6 times a day. We can make it enjoyable for everybody.
And I think you touched upon this one as well. My 4-year-old is starting to get picky and never used to be. He eats all foods, rice, meat, seafood, sushi, but now mostly just wants PB&J and cereal.
So that's that division of responsibility, the child saying what I want. And in that instance, it's okay. Okay, we can have, that can be part of your 80%, but what's going to be the 20%?
Right.
That we're still, as the parent, deciding what's on their plate.
Should a kindergartner be able to say "are" correctly?
That one comes back to me. So that goes back again. We were talking about how by about the age of 6, we're looking at children being able to articulate or say all those speech sounds accurately. So it is quite common. We hear a lot of parents saying, well, they can't say there are yet. We'll sit and wait. There are many factors that influence that ability and difficulty to say the R. There's a lot of that oral motor, that mouth movement and that coordination, where the tongue is placed. So if you're feeling concerned or your child's feeling frustrated, a consult with a speech language pathologist may be warranted. As we're getting into kindergarten, we're starting to read and write. So it's definitely a great time to be working on that sound.
I understand everything my child is saying, but strangers don't. Should this be a concern?
So really it's depending on the age of your child. We expect that mom and dad are going to be the first people to understand what their child says first. Grandma and grandpa might have a little bit more difficulty at first, or a classroom teacher. As their speech develops, we really do expect that children become more intelligible or understood by unfamiliar listeners. But if your child's becoming frustrated, really allow them time to speak. Don't speak for them or interrupt them, because that's just going to make them become more frustrated. But if you notice that your child's not really producing a variety of sounds, or really having some difficulty producing some sounds, making it difficult for you or other people to understand, that might be a sign that there's a delay, and a good time that reach out to a speech language pathologist.
Another question we got was mom of the 11-month-old who doesn't eat a lot. Is it okay to keep feeding him purees and formula until his feeding therapy appointment in early July?
I think I would defer that question over to the pediatrician. I would want to make sure that there aren't any growth concerns. But in the meantime, July is right around the corner. As long as meal times are successful, as long as meal times are enjoyable for both the child and the parent, I would continue with what you're doing. We want to keep meal times, regardless of child, enjoyable, just so then we are intrinsically motivated to eat and to participate in it. So I would continue with it as long as your pediatrician does not have concerns about growth or nutrition for that matter.
Another question relating to kindergarten. Should my child be able to cut and color in the lines by kindergarten?
Sure, I can speak on that one. So when we're entering into kindergarten, a 5-year-old should be able to independently put on scissors and cut out simple shapes. So that just being a circle, triangle, square, and then our more complex cutting starts to develop in ages 6 to 7, I would say. And also when entering into kindergarten, we should start to see. I'm going to hold my little crayon up here. Let's see, a dynamic tripod grasp, if we can see. There we go. And we're going to start to see the movements come from the fingers rather than the whole arm. So, but when entering into kindergarten, you should start to see them coloring within the lines, grossly coloring in within the lines. So if you are seeing some difficulties with cutting at age 5 when they're entering to kindergarten, I would say you could do a screen and just make sure some of those fine motor skills are on target.
Wonderful. One more question. I'm being challenged with tantrums on a regular basis. Is this just a phase? I think this is a very common question.
Yes. Tantrums are normal. They are normal, and we all deal with them with our children. I think when we're looking at tantrums, we want to look at the intensity of them. So just a rule of thumb that tantrums you should start to see them decrease by age 5. That doesn't mean they completely go away, but they should start to decrease in frequency and duration. So things that we're looking at, just benchmarks for social emotional kind of those things when we're looking at tantrums. Between ages 3 and 5, they should be responding to caregiver soothing. And then, being able to calm themselves within a reasonable time. So if we're having tantrums that are every day and they're lasting an hour and they're not accepting any kind of soothing from an adult, those are some signs that we might need an occupational therapy screening to make sure that we're taking a look at their social emotional skills. And but tantrums are normal, yes, unfortunately. But again, we just want to, if they're impacting your day and the function of your day, and the whole family is frustrated, it can't hurt to be screened and see if there's, a lot of times the sensory processing and the social emotional skills go hand in hand. So if there's some sensory things going on and some social emotional things going on, it can't hurt to have an occupational therapist investigate a little bit more.
Wonderful. Well, it is time to wrap up this episode of Nest Builders. We want to thank the team from McKibben and Monte for joining us tonight. It has been a blast, and I'm sure the audience has learned just as much as I have. And also thank you to everybody who asked them questions. You can learn more about McKibben and Monte by visiting their website at www.mckibbenandmonte.com. Or if you're in Ohio, Kentucky, or the Tampa, Florida area, check out the website to see if an office is near you. Before we leave, we need you to mark your calendars. Our next Nest Builders event is on June 18th at 8 p.m. We will be joined by 4 of our directors from schools around the country to discuss getting your child ready for kindergarten. Joining us will be Sydney Crow, our director from Lakeland, Florida, Carolyn Amydown, our director from Centennial, Colorado, Kendra Allen, our director at our school in Noonan, Georgia, and Samantha Ackerman, our director at our Loganville, Georgia school. You can sign up for the event and learn more by visiting www.thenestschool.com/nestbuilders. Until next time, thank you for joining us and have a wonderful evening.